During the winter season, the newborn usually suffers from hypothermia. It's a medical term. This hypothermia means extreme cold exposure to the newborn. Another thing which they suffer during the winter season is the common cold or the runny nose, which can lend up to pneumonia like health issues. There is a various skin diseases which the child suffers during the winter season. These are some of the common problems and the bacterial and viral infection which they suffer during the winter season. During the winter season, parents should look whether the child's temperature is optimized or not. That means there should be a specific temperature. If the child is very much cold, the parents should see to it, and this they can see with the help of a digital thermometer. Or if they don't have this digital thermometer, they can use the back of their hand and compare the temperature of the center of the body with the extremities. If both are cold, it means the child is on the extreme cold exposure. If the center is warm and the peripheries are cold, it means that the exposure to cold has just started and they should properly take care of the baby. And the other thing is both are on the warmer side, which is the normal body temperature which the child should have. Other than this, the parents should take care the diapers are not wet, the babies are properly breastfed with the particular time, that is 1.5 to 2 hours. During the winter season, it is very much important that you maintain a warm atmosphere for the babies. For this, you can give the babies 2 to 3 layer of clothing so that there is a air in between which work as an insulating surface and the baby will be kept warm. Other than this, diaper should not be wet. There should be a proper skin to skin contact with the mother. Mother should feed the baby every 1.5 to 2 hours with proper burping for around 30 minutes. This burping and proper breastfeeding will keep the baby warm. Other than this, diaper should be changed properly and there should be no exposure to the direct fan because the waves of the fan will create a cold atmosphere which will be dangerous for the child. The first hygiene part is the proper hand washing. Parents should wash their hands frequently and then whenever they are touching the babies, before that they should clean their hands and warm it. Other than this, if they have some cold or something, they should wear the mask. Breastfeeding should not be stopped. Mother, if they are having the cold, they can just wear a mask but continue giving the breastfeeding to the babies. These are the proper just hygiene measures which they should follow, and there should not be excessive people around the newborn because every person has some sort of infection. Whenever they talk, they transfer these infections to the newborn. The newborn's immunity totally depends on the breastfeeding. Breastfeeding or the breast milk has all the essential antibodies, minerals, vitamins, whatsoever a newborn require for his general growth. So it's not just about the winter season. For any time, the breastfeeding is sufficient for the growth of the babies. So you should just focus on exact amount of breastfeeding and that too at proper times. Means 1.5 to 2 hours. Mothers should breastfeed their babies. Breast milk is the best thing and it should be the only thing which mother should give. Other than this, like the cow milk or the janam guttis or the honey, gripe water, all these things are not good for the and even the cough syrups. These are not good for the health of the baby and you should just focus on giving the breast milk. Other than this, if any medical supplements you want to give, that is the vitamin D, or for some smaller time you can give multivitamins. Other than this, nothing else is required for a newborn. While traveling, there is a lot of infections which are in the atmosphere wherever you travel. If you are traveling by, let's say, a train, there are a lot of infections. Now, some people ask if we travel by car and we maintain a normal temperature, is there any risk? Yes, there is definitely a risk because wherever you will reach, different sort of viral and weather condition will be there at the next wherever you are going, so that local area's infection and weather will affect the baby and will cause a minimum of cold or some weather changes issue to the newborn. Till the child is around 6 months old, parents should avoid traveling to different areas But if at all they wants to travel, just cover their ears, cover their palms and soles with socks, so that they don't get exposure to the cold.